The airway is the tube that we have to breathe. So it starts at your nose and goes all the way down, and so it touches all different structures. There are components that are involved with various specialties, which is what makes this kind of a complex topic. In the nasal area, that would be an ear, nose, and throat doctor that's in charge of that space. But then when we get to this part, that's a combination of many different specialties, whether it's an oral surgeon, ear, nose, and throat doctor, or dentist. And that's why collaboration is really important for airway health. We're really designed to be nasal breathers. Our nose is meant to warm, filter, and slow our air. Thank goodness that we have a backup option. We can breathe through our mouth, but we're not designed that way. When we bypass all those natural functions, there are consequences. If the air is not filtered, that's just going to cause a lot more inflammation. It's going to dry out the oral mucosa. We really want to do everything we can to promote nasal breathing. There's a lot of reasons why we might not be breathing through our nose. One of them is that there's a nasal blockage or deviated septum, but there are other reasons too. There might be allergies on board, there might be enlarged tonsils or adenoids, or another reason could be that there's a tongue tie. Or really there are studies also that show that you can be breathing through your mouth because as a child you see other people breathing through their mouths. There's a lot of different reasons why that might happen, and that's why a detailed evaluation is important, so we can kind of determine what those contributing factors might be in that case, because it's not going to be the same for everybody. If we're not able to breathe through our nose, that can have a few different effects. One of them is that the tongue is going to be sitting low and back, and that tongue is going to be physically blocking the airway more. It also increases the resistance that our air has to pass through that path, and that can cause something called upper airway resistance syndrome, which is just a prequel to sleep apnea. It's powerful to be able to nasal breathe, and those have great health benefits, but if we're not able to do that, there can be some detrimental effects on our health. Sleep is really important during development because that's when we're growing and our brains are 90% developed by age 4. And that's when our body is meant to detoxify. That's when we're forming our memories. And that's when a lot of our hormones are released. So if we're not able to get quality sleep, REM sleep, then those normal health processes that are supposed to happen during sleep just can't. So just because we are asleep for the right amount of time doesn't mean that sleep is quality. And so it's important that we're looking into if we do have that quality sleep and if we're getting that restorative sleep that we need. Some of the common signs and symptoms of sleep disorders are things that your dentist might identify or that you might identify at home. So from a dental perspective, we're going to look for signs of wear on the teeth. We want to look that the upper teeth are not covering the bottom teeth when you're biting, so that the lower teeth are visible when we're biting, that the upper jaw is sitting outside of the lower jaw, and that the lower third of the face is growing ahead of the forehead. So those are signs that we would look for. We also want to see in a dental exam that there's spacing between the teeth about the size of the width of a quarter, and if there's wear on the teeth. From a parent perspective at home, things that you might see that you may not be aware that are connected or possibly an airway disorder. And to preface that, I always tell patients there's no one thing that means anything by itself. Just because you see one of these signs or symptoms doesn't mean there's a problem, but we want to kind of play detective to see what pieces of this puzzle can we put together that might form a pattern that might need attention. So some of the things to look for at home are if the sheets are really messy, if a child is snoring, breathing loudly during the day, bedwetting, teeth grinding, falling asleep during the day, feeling really tired and hard to wake up in the morning, and a lot of movement during sleep, trouble falling asleep. And those are kind of some major signs that we want to just be on the lookout for as we're growing. But it can be hard because really, even after infancy, we're not necessarily in the same room as our child. So from a parent perspective, a good night's sleep is the child didn't wake me up, right? And that's great because sometimes we don't meet that goal. But just because a child doesn't wake us up we still don't know about the quality of their sleep until we're actually looking and testing. So I like parents to make a video of their child sleeping so we can kind of look at those breathing patterns, listen to the breathing patterns, look at the movement, and sometimes we'll do actual sleep screening or sleep tests to kind of get even more data. It's important that we go through a diagnostic process to kind of get a lot of information about these patients because there's no one treatment that's going to work for everybody. And that's why continuing education is so important. That's why it's important to have a big toolbox, lots of options to offer, because we want to kind of tailor treatment options to the patient based on their goals, the severity of their issues, where they are in growth and development. Is it preventive or do we need to get results quickly? These are all factors that are going to kind of weigh in.